Welcome to Health Watch, presented by NOVANT Health. I'm your host, June Baker. Today our guests will include Dr. Donald Ludlow of SEASHORE Pediatrics regarding children and allergies, as well as Dr. Miller Van VLIET, an anesthesiologist with Brunswick NOVANT Medical Center, and finally SELENA BOYETTE of Lower Cape Fear Hospice and Life Care Center, who will discuss hospice care. Stay tuned to learn about valuable health topics with Health Watch. Welcome to the show today, Dr. Ludlow. It's such a pleasure to have you.
Thank you. I'm glad to be here.
Great. Now, I understand that you are the founder of SEASHORE Pediatrics. Is that correct?
That's correct.
Well, tell me a little bit about that practice.
Okay, we've been here for about 10 years now. We started out in South Carolina in Norris and Little River, and over the last 2 years we've expanded to also cover Charlotte and Brunswick County.
And I think you're located right off of 17.
Yes, right in town off 17, right next to the Days Inn.
Oh, great. Well, that's a good
Yes.
landmark
Yes.
to give. Now, I understand you have some partners. Who are your partners in the practice?
I have 4 associates, and the first is Dr. Michael Sanger. The second is Dr. Ramon Youssef. The fourth is Dr. Kenneth Richards, and most recently, Dr. Fong Bu.
Wow. So you have several offices, is that correct? Or?
Yes, we have 3 offices right now. We have an office in Loris, South Carolina, and in Little River. We operate or associated with those offices with the McLeod, Lower Seacoast Healthcare System. And then we have our newest office in Charlotte. As I said, we've been there for about 2 years, and we're associated with Brunswick Hospital.
Great. Well, I know we're happy to have you here in the area.
Well, thank you.
So tell me, how did you become a pediatrician? Let's talk a little bit about your education and your background, because I know yours is a little different.
Sure. I started my medical training in Philadelphia at Drexel University, and you know, during my medical school years, you kind of decide what you want to go into. And I like general medicine, and I like challenges. I like to be involved with all body systems. And there was a choice between adults and pediatrics, and I just found that children are, it's just funner to deal with children.
Right.
Most of them do get better. They have a great attitude toward life. They're happy. They make me happy, and I just enjoy working with children.
Oh, that's great. One thing that's important to parents when choosing a pediatrician for sick visits, how does your office handle sick visits?
Well, my philosophy is that if you have a sick child, the child needs to be seen as soon as possible.
Great.
Parents are worried about their sick kids. So in my practice, the rule is, and my office staff knows that, if your child is sick and you call in before the office is closed and you can get there before the office is closed, you will be there, you will be seen that day.
Wow. That's a great philosophy.
And it works, and everybody's appreciative, and that's what we're there for. We're there to serve the community and to provide help where it's needed.
Yeah, it's been many years, but I can remember when my children were sick and waiting by that phone for that call back, and of course they always got sick at night or on the weekend.
Right. Well, the other thing that we do, if your child does get sick at night, and they do, and on weekends,
they do.
You still call the office, and actually the pediatrician on call will talk with you and tell you what you can do until we can see them at the office.
Now that's pretty amazing.
Yeah, we try to keep the kids out of the emergency room if they're very seriously ill and we think it cannot wait for us to see them in the office. The following morning we'll send them to the emergency room.
Sure, sure. But I love that philosophy of the sick children being seen now when they're sick. That's great. I know that you have well child waiting areas, and you have sick child waiting areas. Talk to me about that philosophy and how that all works in the scheme of, you know, the office, how they get through, and don't infect everybody else.
Sure. Well, as you know, pediatricians deal with sick children and well children.
Correct.
It's very important that, you know, we see children on a regular basis for well checkups to make sure that
Right.
they're growing, developing appropriately, and to get their immunizations.
Right.
And you being a parent yourself, as you know, when you're bringing your well child into an office full of sick kids that are sneezing, coughing, and febrile, it's something that makes you feel very uneasy. So it occurred to me a long time ago that it didn't make sense to have all these well children in with the sick children. So we've separated our offices so that each office has a well area and a sick area, and we try not to intermingle that.
That's great. You know, I wish that more primary care offices would develop that because I don't like to walk into an office and sit next to somebody who's sneezing and you can tell they're very sick, and you're not sick. You're just there for your allergy shot or whatever. So I think that is a great way to do it. Well, today I wanted to talk a little bit about allergies. I know I have them, and my children always had them and still have them as adults. And I know it's this time of year, so how do parents identify when their children have allergies versus a cold?
Okay. Well, there isn't a lot of overlap of symptoms, of course, but there are a few things that help distinguish. Number one, when a child is sick with a cold, often they'll not feel well. They may have a fever. They have other associated symptoms, and they just generally feel weak. With allergies, on the other hand, you generally feel pretty good. It's just that you feel like you're a dripping faucet.
Yeah.
Of course, the most common symptoms are itchy, watery eyes, stuffy nose, nasal congestion, continuously running nose, scratchy throat, sometimes a cough.
Yeah. Well, what about classic triggers for seasonal allergies? Are there some of those?
There are, of course. Pollens are the big ones. We have different seasons for different pollens. The trees start first, usually between February and May. Then come the grasses from about May to July, and then we have the weeds, of course, ragweed being the most common one toward the late summer, early fall, and the molds. Spores right there in the middle in the midsummer to early fall.
Pretty much all year round.
Pretty
There's
much,
something.
Pretty much. And those are seasonal allergies. Of course, you have the perennial allergies, which are the dust mite, the cockroach, the dog dander, things like that. And those symptoms tend to occur throughout the year, not just seasonally.
Well, if parents think that their children have allergies, what would you suggest what route should they take?
Well, if there's a question, first of all, usually there's a family history, often there is, and they pretty much know if they've had allergies themselves. And at the earliest onset, of course, the mainstay you try to do is try to eliminate exposure as much as possible. If they're always getting allergy symptoms and you know, when the grass is growing, then you try to keep them indoors as much as possible when the pollen count is high, and you can follow those on the internet or on the television.
Oh, that's true.
Yeah, early mornings and early evenings are probably the best time because the pollen counts are lower at that period of time. And then you now have some antihistamines over the counter that used to be prescription that are quite safe in children. One being you know, loratadine or Claritin, the other being cetirizine or Zyrtec, and both are available for children 6 months and above.
So they should just talk with their physician.
Talk with their pediatrician or physician, and they'll advise you what to do.
Apart from seasonal allergies, there are other types of allergens, and I think we touched on that a little bit.
Right. You have the perennial allergens. Those are the ones that are in your home all year, such as dust mite, that's a big one. Cockroach is another one. You have, of course, cat.
I didn't know you could be allergic to cockroaches.
Yeah, real common allergy, actually.
I
very
did not
common.
know that.
And of course, you know, cockroaches are everywhere. Everywhere that we don't
they call
want
them
to
palmetto
be.
bugs, I think, down here or something.
Yeah, they do. And they're big down here, too.
They're very big. I didn't even realize that you could be allergic to them.
Now, with those kinds of allergies, of course, because symptoms are all year long, you tend to, you know, no one wants to stay on medication all the time. And there are other, you know, prescription medications you can use. And then if medications don't help, that's where the allergist comes in, where you can do some specific allergy testing. And, you know, if you're allergic to everything and needing to be on medication all year long, then sometimes allergy vaccine or hyposensitization therapy is the way to go.
And what about food allergies?
Food allergies are thank goodness, not as common as people think, but you hear a lot about food allergies. The most common
Milk,
ones.
I always hear milk.
Yeah, milk, eggs, soy, wheat, tree nuts like walnuts, peanuts, fish, and shellfish. Those are the big common culprits of food allergy. The danger with food allergy is that they have a tendency to be more severe and can be life-threatening at times. So it's something that if you think your child has, that's something that you should certainly see your physician for.
Well, it's been my pleasure to have you here today. It's been great information, very interesting. Are you taking new patients?
Oh, absolutely.
And how might they make appointments with you?
It's very easy. If you would just call the office at any point, it's 910-754-BABY. Baby meaning 2229. So 754-BABY.
754-BABY.
Yes.
Great. Well, thanks so much for being here today.
Thank you, June.
I look forward to seeing you again. We can talk about some other great topic of
I would love
children.
to. Thank you very much.
Thank you.
Thank you.
Well, welcome to the show today, Dr. Van Vliet. It's so nice to have you here.
Thank you very much.
Good. How long have you been at Brunswick NOVANT Medical Center?
I just started in August.
In August, so you're the newbie.
I'm the new guy.
Well, I'm curious, what brought you to Brunswick County?
Actually, I live in Wilmington, so
you?
I'm not too far away, but it was time for a change in my career. I've been in large regional medical centers for the last 16 or so years of my career, so it was time for a change, and I was looking forward to I was looking for a place to go to where I could play a bigger part in patients' care and be a little more personal, a little more involved, and just kind of have a little more intimate setting where I could be more active in their care. And the large medical centers, you get kind of lost, and it's kind of frenetic, and this just kind of stumbled upon me and
oh, that's
worked
great.
out perfectly.
Oh, that's great. And you didn't even have to move.
No, it was funny. It came, I was just about to accept a job in Colorado, and literally within 24 hours, and I got the call and told my wife we didn't have to move. And
oh my goodness.
She was
and she was happy.
Yes, so were the kids. They got to stay in their schools, and everything was great.
Oh, that's wonderful.
Yes, ma'am.
That's wonderful. Great story. Well, talk to me about your education and your background. How do you become an anesthesiologist?
Well, typical pre-medical training, just like everybody else. I did most of my training, or all my training, in the Northeast. I'm a Northeast boy, and I crisscrossed Pennsylvania through college, 4 years of college, 4 years of medical school, and internship, so just typical medical school process. And then after medical school, like most doctors, you choose which specialty you want to go into, and I chose anesthesia, and so I did my anesthesiology residency in New York, and I went up to Strong Memorial at the University of Rochester and completed my residency in New York. And then, like
great
I said,
facility.
Yeah, it was fabulous place. But like I said, and if you include, like I said, the last 16 years plus the training, you know, like I said, it's 20 years now.
You don't look old enough to have
no,
been there.
No, well, it has been a while, but yeah, 20 years in the big facilities with, you know, the high-risk OBs and lots of pediatrics and the trauma and the neuro and things. So, like I said, it was time to kind of step back and enjoy life for a little while and a change of pace.
Kind of the best of both worlds.
You got it. You got it. It's a nice change.
Yeah. Well, tell me about the team, the anesthesia team at Brunswick NOVANT Medical Center.
Fabulous team. I couldn't have asked for better. There's 3 doctors: Dr. Brand, Dr. Mix, and myself. And then there's a fabulous crew of currently 5 CRNAs, and the way things are going, the place is expanding. I wouldn't be surprised if there's, you know, if we get a few more here in the next little bit, but 5 CRNAs or nurse anesthetists that we all work as a team in the care of patients, and there's one of us through, you know, with the patient throughout the entire time, and if not 2 of us throughout the beginning and critical points of cases.
Okay, well, let's talk a little bit about anesthesia. Give me a brief overview, I'm sorry, of what anesthesia is.
Anesthesia is, it's kind of like witchcraft. Not many people understand exactly what we do. We're the Lone Rangers. We come in with our masks, and people don't really understand what we do. But it's the specialty where we provide pain relief and amnesia for surgical procedures. So
I like that amnesia part.
Right,
I've had
you don't
surgery.
remember,
I don't
you don't
remember.
and you don't feel, and you're comfortable throughout your procedures. Basically, we make sure you're comfortable and don't remember anything. But also, I think a big part of things that people don't realize about anesthesia is that we're dealing with people in a very stressful, critical point when they come in. I mean, surgery is stressful for people.
It is.
Whether even a routine hernia or an appendix can be, it's scary. I mean, people, an operating room is a different place for people. And you come in and you're stressed out, and some people are terrified, just let alone needles, operating rooms. And so what I was saying before, being more involved in a more personal, intimate way, dealing with people is during that stressful point, whether you, through reassurance and through education and telling people and educating them about the procedure, as well as through medicines, to relax them and relieve their anxiety and stress level during that and before and after the cases is a huge part of my job, and making sure that their experience is as pleasurable as possible and as stress-free as possible.
Mm-hmm. Now, I know there are different types of anesthesia. Yes, sometimes you go to sleep, and sometimes you just lose feeling. Talk a little bit about those different types.
General anesthesia is what probably most people think of, where you're rendered unconscious.
That's where you go
totally
to sleep.
Asleep, correct. And most of the time you have a breathing apparatus, whether it's a breathing tube or we have special face masks and things like that. But where you're unconscious, you're asleep, we wake you up. You go to sleep, and we tell you where people think you count backwards, and the next thing you know, you're in the recovery room, and it's all done. That's a general anesthetic, all anesthetics you'll need an IV for. But the general anesthetics where you're rendered unconscious and we put you to sleep, and you're hooked up to the ventilator. We take care of the breathing and all. Basically, we control your vital signs and your physiology during that period. There are spinal and epidural anesthetics where we basically anything from like your belly down we're covering, or the lower half of your body, whether it's lower abdomen, your lower extremities, where you don't need to be totally rendered unconscious. It's a misconception that you have to be wide awake for that. You absolutely do not. We can still keep you asleep, and you don't need to hear anything that's going on, or you can be as asleep as you'd like, but the main comfort level or pain control is coming from that spinal or epidural.
I see.
It consists of an injection in your back, which sounds worse than it is. Most people hear those wives' tales or the old horror stories or things like that, where you can get paralyzed, all those things that don't happen, that's not true. And it sounds worse than it is having a needle back there. I've had an epidural, it's not awful.
Yeah, I've had one too.
And it's not a bad thing. The difference between the two is a spinal has a very finite lifespan of how long, depending on what medicine we give you, how long that lasts. It's a one-time shot, and certain medicines last an hour, certain 2, 3, whatever we choose will last a certain amount, whereas an epidural, we actually leave a small catheter in the back, and that can last for days.
Oh, you could extend the time.
Correct. Or like when women have it for labor. Some women's labor go quick, some women's labor last for a day. And so we can extend and just prolong and give medicine as long as we need to through that catheter. And there's a third type that's gaining popularity, is called regional anesthetic, where we can just basically put a region of the body to sleep, or like if we're working just on the wrist or just on somebody's arm or leg, and we can just put that region to sleep. And so with the advances in, especially with ultrasound, we can use an ultrasound machine and identify the nerves, say in your neck or in your hip or things like that, and just numb a certain region of your body. Again, you can be sleepy during those procedures, but if some people have certain medical issues that we shouldn't put them to sleep, or it's not safe to put them asleep, or they don't want to be put to sleep, that their procedures will allow them to have this type of anesthetic. I can just put your ankle to sleep if we're working on your toes. So it has certain risk benefits that we weigh for each individual.
So that's how sometimes you choose the right anesthetic for the person, because you decide based on their health and their condition.
Every case
is different.
Absolutely, and so the surgeon, the actual surgery, the surgeon's needs, medical issues, as well as patient preference. I mean, you and I, we determine what your anesthetic is going to be.
Oh, that's a great.
It's not determined which way you're going
Right.
to go before you set in that hospital on a lot of cases. And you play a role into which way or what anesthetic you're going to have. And we determine that, you and your anesthesiologist determine that the day of surgery.
Wow. Well, it sounds like you have a great program at Brunswick NOVANT Medical Center.
Wonderful.
And it sounds like you're doing a great job, and you seem very happy there, and I'm sure they're happy to have you.
Pleased as punch.
Yeah.
Yes.
Well, thank you so much for being here today. It was a pleasure having you. I look forward to seeing you soon.
And thank you for your time.
Welcome to the show, Selena. It's so nice to see you again.
It's good to see you.
Thank you. Well, how long have you been with Lower Cape Fear Hospice, and what exactly is your role with the organization?
I've been with Lower Cape Fear Hospice for about 4 years, 4 wonderful years. And my job currently is that I'm the Director of Provider Outreach. And what that means is I am the clinical person, the nurse person that works with the people that get the message out, reach out to the community. Largely, my team works with providers, physicians, hospitals, nursing facilities to help them better understand what we can provide with hospice care.
So you are a nurse by profession.
I am.
Talk to me a little bit about your background and your education.
Interestingly enough, I started out as a teacher.
Really?
I'm a proud East Carolina pirate. I went to School of Education and taught for 7 years. After that, I had a baby, and my nurse was so incredible that I decided to change careers. That's what I needed to do. So I went to Cape Fear Community College, and after that worked in the intensive care unit at New Hanover. And there I met the palliative care team through Lower Cape Fear Hospice, and they helped me realize my calling to end-of-life care. After that, I worked as a nurse, a hospice nurse in people's homes and facilities. After that, I worked with that same palliative care team in the hospital. I've been in this role for about, well, since last March.
Wow, interesting story. You've done a lot, and it seems like you have found your calling.
I have.
Finally, huh? Well, we're here today to talk about hospice care, and I think that's a little understood term. I know that there are some misconceptions, some common misconceptions out there. So first of all, could you tell me and our viewers what actually is hospice?
You know, it's a very scary word, isn't it?
It is. It is.
I spend most of my life talking about some of the scariest things people ever confront. For me, hospice is hope, but hospice is really a Medicare benefit. It's a team, holistic approach to care. It means that it's a big set of arms to wrap around you and your family when you're facing end of life or chronic disease. It gives you a nurse and a social worker and a chaplain to work with you to help meet your goals for end of life, whatever they may be. They work with your physician. We also have hospice and palliative certified physicians that help oversee the care. But hospice is that group of people that help support your family and whatever needs they have, be they for your medical needs or for your psychosocial needs is what we clinically call it. But, you know, caregivers have a big role to play, and that strain is, facing end of life is humbling. And so you need a lot of support from a lot of different angles.
Are there ever volunteers needed or utilized in this
Absolutely.
process?
I'm so sorry I didn't mention that. So you have your nurse, your social worker, your chaplain, and you can always have a volunteer. At Lower Cape Fear Hospice, we are so honored to have 600 volunteers to serve the patients in the 5-county area that we serve. And those volunteers can be a part of your everyday care. On our website, there are some stories that you can watch, and you can see one volunteer who goes and plays pool with a gentleman. To help improve his quality of life, to help him live well. We also have volunteers that perform clerical tasks in our home office to help us with mailings and all of the daily things that go with making sure that all our I's are dotted and T's are crossed. We also have a vigil volunteer program where if somebody doesn't have family or a loved one, a volunteer might sit with them in their last hours. So there are many roles for many volunteers, and we're so appreciative of that part of hospice care.
Some people, and I kind of thought this, that hospice care only related to elderly folks, but I understand there's probably younger folks in this program also.
There are. Everybody thinks about hospice and cancer or hospice and the elderly.
Exactly.
Hospice is not just for the elderly. We have served children. As sad and horrible as it is to lose young people, they need that care too. We don't do that a lot. A large majority of our patients are elderly. I'd say 91% are Medicare patients, but they're not just cancer patients. And when you talk about cancer patients, that is 41% of the people that we provide care to. And cancer knows no age limit. We have, you know, I think hospice is even more important sometimes for younger patients that have families and have needs. You know, if you're a young child and your parent may pass away, there's a lot of coping and grieving before and questions. And at Lower Cape Fear Hospice, we are fortunate. Not every hospice has such a large bereavement department, but we have specialists in bereavement for children who can help families with anticipatory grief before their parent may pass away. And there's lots of different ways that we can help anybody wherever they are at any stage at end of life, any stage of their life, rather.
Oftentimes we think of hospice is the place you go in those last weeks or the last few days, but it can be a longer period of time. Is that correct?
Absolutely. There are two misconceptions that you just mentioned. One, that hospice is a place. Hospice is wherever you are. Lots of people say you go to hospice. Now, we, again, are very fortunate at Lower Cape Fear Hospice. We have a new care center in Brunswick County that the people in Brunswick County...
And it's beautiful. I've seen it. It's gorgeous.
It's a beautiful place of great hope. And that is a place, and that's for intensive symptom management. And usually if somebody's there, it may be in the last days or weeks of their life, but people also leave that care center and can return home if they do better with their symptoms. But, you know, I don't think people realize the full benefit of hospice if they only have it for a few days or a few weeks. You know, the Medicare benefit is set up for 6 months. You know, to qualify for hospice, you might have a prognosis of 6 months if the disease follows its normal course. Now, what does that mean? What if you live past that 6 months?
Really? What happens
We're all
then?
hopeful for that. You know, Medicare it's unlimited. You know, as long as you're continuing to decline or have need for hospice, it is unlimited. We've had patients on our service for over 2 years or so.
And that would be service within their home?
Within their home, yes, or their assisted living facility,
or wherever
or in their
they
nursing
reside.
facility. Wherever they live, we can serve them. We've even served patients under a bridge. I'm not kidding.
Really?
We meet you where you are. And that's where our social workers come in to try to help you find a better place to be. You know, I think that even though patients may have hospice for a few days, they don't realize the full benefit. You know, when you're at end of life, you're facing a lot of things. And when you have all these people coming into your home, you need to develop trust in a relationship. One of the biggest things that our families tell us is, I wish I had you sooner.
Yeah, people wait too long.
They do, but they don't know. And that's why we're here.
But that's why you're here today, and hopefully we can clear up some of those misconceptions by having you here today. I know that oftentimes we do think of hospice and cancer, but what other illnesses might qualify a person for hospice care?
A lot of chronic diseases. We see patients, you know, I said 41% of our patients are cancer patients, but we see patients with advanced dementia. We see patients with end-stage lung disease or COPD. We see patients with heart disease and CHF, ALS,
I
liver
never even
disease.
thought about that.
Any disease that is chronic and progressive and develops into an end stage.
Well, Selena, before we close, I want to make sure folks know how to get in touch with hospice, how to start this process. How does that happen?
You know, a lot of times a physician will recommend, and a physician does have to order hospice, but all you have to do is call hospice or visit our website to find a number you can get in touch with us. Anybody can refer somebody to hospice. If you have a neighbor that needs hospice, you can refer them and say they have a need. And we'll pick up the pieces from there and call the physician and talk about those needs and see if the physician is in agreement that that is what's needed. You can visit our website, hospiceandlifecarecenter.org, and find out lots of information about Lower Cape Fear Hospice and who to call, where to call. Just there's a bevy of information there for anybody who has additional questions.
Well, great. This has been a truly enlightening conversation for me, and I hope for others out there, and I'm so thankful you were here today, and I hope to have you back again because I think there's lots more to talk about.
There is. I hope everybody can realize that hospice is about living well because we believe that every moment matters.
Well, thanks again.
Thank you.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was helpful for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to me at atmctv@atmc.coop. For more information on the hospital, local doctors, and general health information, please visit brunswicknovant.org. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.